Hi, I'm Sarah from the University of Canterbury. For most families involved with child protection services because of abuse or neglect, the children remain in their parents' care. Only a small proportion are taken into foster care or kinship care. This means that children can grow up being harmed throughout the early development, causing day-to-day suffering as well as really serious developmental consequences later in life. Professor Michael Sweeney and I were interested in finding out what scientific evidence there is to show that the parenting interventions we use with maltreating parents are actually effective. So there are lots of studies that have looked at solving this problem, but there hasn't been a review that has specifically looked at studies where there is an objective measure of maltreatment, such as notifications to child protection services to show whether or not the intervention was effective. This is important because notifications are a hard marker of abuse actually occurring, whereas other soft markers like scores on questionnaires or parents improving their positive parenting skills might not actually be accurate indicators of whether or not the abuse or neglect has stopped. So our review found 9 studies that had trialled parenting interventions that used notifications as an outcome measure for families where maltreatment was known to have already occurred. Most of these studies were randomized controlled trials, and there was an average of 24 sessions across all the studies. 5 out of the 9 studies showed no significant differences between the intervention group and the comparison group. 4 studies using 2 parenting interventions did show significant differences on outcomes. So these were parent-child interaction therapy and safe care. Both of these interventions used education, modelling, and feedback with parents. But so did some of the other interventions that did not show good effects. And with these studies of parent-child interaction therapy and safe care, there were some limitations with the methodology. So overall, we concluded that at this point, we don't have robust evidence to show that the parenting interventions that are currently available work with maltreating parents. We found that long-term home visiting programs are ineffective at reducing abuse and neglect when compared with usual services. But there are some interventions based on social learning theory that show promising results. There were 2 components that might be particularly important for intervention. The first is coaching to mastery, which means parents learning skills until they're automatic, and including a specific component of the intervention that targets child neglect. So we need to think about parents who have abused or neglected their children as different from other groups of high-risk parents. They're less responsive to intervention. Because of this, we need to keep researching what works for this population so that we can reduce child abuse and neglect and help families to change. You can read the full article on the website of the journal Developmental Child Welfare.